Pregnancy and domestic violence. Risk begin before birth. Joy Martin, Frontier Nursing University. Domestic violence is a tremendous problem in the United States. The American College of Obstetricians and Gynecologists defines abuse as any behavior designed to control another person, whether it be physical abuse, such as hitting, pushing, choking, kicking, or emotional abuse, such as threats and intimidation. It is difficult to know the exact magnitude of the problem because much of the abusive behavior goes unreported. Estimates do show that more than 1.5 million women are victims of physical or mental abuse each year in the United States. Domestic violence is of specific concern whenever the victim is a pregnant woman. The increased stress that accompanies pregnancy tends to initiate new onset of abusive behavior and can intensify existing violence. Pregnant women are 3 times as likely to be killed during one of these attacks. We will look at the consequences to the unborn fetus when the mother is a victim of domestic abuse. The woman experiencing physical or emotional abuse may be isolated from her family and friends, leaving her increasingly vulnerable during pregnancy. While physical injuries such as abrasions, bruises, and broken bones may be obvious signs to the care provider, the woman may demonstrate more subtle signs of abuse, such as poor weight gain, depression, chronic pain, or anxiety. These women have been found to be at risk for late entry or inadequate prenatal care, which can lead to anemia, untreated hypertension, or preterm labor. The physical trauma experienced by women abused during pregnancy can potentially lead to life-threatening maternal outcomes. Abdominal trauma may lead to uterine contractions, placental abruption, or even fetal death. The sexual assault or abuse of a pregnant woman can cause placental damage or premature rupture of membranes. These physical injuries to the mother directly affect the unborn fetus she carries. We will now take a moment to examine the neonatal effects of domestic violence. The fetus is dependent upon the mother to provide a safe environment to thrive and grow. When the mother is abused, the risk of fetal death, preterm birth, or a low birth weight infant more than doubles. The risk for delivering a small for gestational age, or SGA infant, quadruples in the presence of domestic violence. In addition to extensive stays in the neonatal intensive care units at birth, these babies are at increased risk for death throughout the first year of life. The risk for prematurity and low birth weight can be directly related to trauma suffered by the mother or may be related to associated behaviors exhibited by the mother. Poor maternal diet, poor weight gain, tobacco and substance abuse are common causes of low birth weight. It is believed that there is an association between increased levels of the stress hormones cortisol and adrenocorticotrophin-releasing hormone that are experienced by abused women that increases her risk for premature delivery. The premature and low birth weight infants are faced with extensive hospital stays in the neonatal intensive care unit and are at increased risk for fetal and neonatal death. The SGA infant is one that falls under the 10th percentile on a growth chart. Research has shown that the effects of being born SGA can continue indefinitely. These children are at risk to have lower intellectual ability and behavioral problems. They are known to demonstrate attention deficit type behavior disorders and other learning disabilities. There is also an association between being born SGA and the later development of adverse health conditions such as diabetes, obesity, heart disease, and stroke. Domestic violence is a tremendous problem in this country. ACOG suggests that healthcare providers question their female patients about domestic abuse at several times during the antepartum period, as women may feel more secure and comfortable after several visits. It is important that the healthcare professional approach abused patients in a non-judgmental manner and not try to force her to leave her abuser, as this may not always be her safest option. Many women are murdered each year when attempting to flee abusive partners. In conclusion, whether physical or emotional, the abuse of pregnant women has consistently been shown to have negative effects for the fetus she carries within her. These women are at increased risk for fetal death, preterm birth, low birth weight, and SGA infants. The burden of caring for these infants begins with extensive stays in the neonatal intensive care units and may continue throughout the lifetime if the child has ongoing physical or mental disabilities.